everyone. I hope everyone is healthy and safe here today. I'm State Senator Susan Rubio. I represent the 22nd Senate District in the San Gabriel Valley. And today I'm happy to be here facilitating this important discussion as we close out Domestic Violence Awareness Month. First, I want to thank all the wonderful panelists who have joined us here today, who will be sharing some important information with us. So thank you so much for adding to the conversation and really highlighting such an important issue. So today you'll hear from esteemed colleagues and local and state advocates and experts on where we were, where we're going, and where should we go ahead. To begin this program, I want to start by introducing someone who I value tremendously, our moderator. Her name is Elaine Whitefeather. She was instrumental in helping me pass legislation in years past. So I want to say thank you, Elaine, and thank you for being here today. Elaine has been a longtime advocate for domestic violence survivors with over 40 years of experience. She worked on policies at the state, federal level, along with partnering with community organizations. So today I have the great honor of introducing her, and she's going to be moderating this discussion. So thank you, Elaine. So I'll turn it over to her. Welcome.
Thank you so much, Senator. It's always a great honor to work with you and to see you again. Hello, everyone. I am Elaine Whitefeather. It's my great honor to be among so many advocates and allies here in our work, and who are going to be part of this great panel and the conversation that we're having about the social issue of domestic violence, intimate partner violence, specifically here in California and locally where you are. As the senator spoke, our topic is where we have been in this movement in the state, where we are now, and where we're going forward. I want to also thank the senator always, and every one of us in this movement who are credible messengers. Like myself as a survivor, we have, for the 40 years I've done this work, used our stories and our experiences to further the cause of our sisters and our brothers, families, and children who are still caught in this pandemic and growing pandemic of domestic violence, especially over the years. It's my great honor to facilitate this conversation, and let's begin the conversation with an update and remarks by the senator, who can share with us what her journey has been and how she has helped us accomplish sustainable change in the state of California. Senator, I'll turn it over to you.
Thank you, Elaine. And again, thank you for being here today. I wanted to share a little bit about my own story. I know that sometimes it's very difficult from an outsider looking in to understand the reality of what happens to victims and some of the challenges that they face. So I can attest to the fact that I can personally understand some of the barriers, some of the injustices, even what we face in the judicial system. And I really wanted to be part of the solution since I am a survivor, and I ran into so many obstacles. At the time, as many of you out there who are victims will understand, it is something that is almost paralyzing. There's a lot of shame. You don't want to speak to people as freely as you should because you're still dealing with what happened to you. And it takes time. It's not easy. And I also hear a lot of the time individuals say things like, why didn't she leave? And I think that that's been something that we've heard throughout generations. But the reality is that every victim comes to their own conclusion. They decide when they're ready to come forward. They decide their timeline. There's so many factors that victims are dealing with. Some victims have children. Some victims are dealing with extended family who don't believe in leaving a partnership, even though it's abusive. Sometimes there's cultural issues that we have to deal with. I know traditionally in Latino households, a lot of little girls are taught to not speak up. Whatever happens in a marriage or behind closed doors is private, it's personal. You don't share with the entire community. And so it's very difficult to overcome those challenges. When it happened to me, it's something that really took me by surprise because I personally did have this vision of someone that's abused, someone that perhaps is not strong enough, someone that perhaps doesn't have the resources to get out of a relationship. But like myself, like so many out there, I'm sure, we learned that all rules, everything that you think about domestic violence is out the door when it happens to you and when it happens in reality. Every circumstance is different. I happened to have been an elected official at the time it happened to me, and the shame was overwhelming. The idea that everyone that knew me would know was really something that stopped me from speaking out. Add to that the trauma of the actual abuse that was happening to me. And so again, I could go on with so many factors that keep women silenced and men, because we know that that's happening to men as well at larger numbers. But the reality is, I'm going to start by asking all those listening that know people and have friends to be more sensitive to each individual circumstance. There's no formula. Everyone comes to their own realization when it's time to leave, when it's time to speak up, when it's time to tell people. And what we can do as a society is support the victims and just offer help as much as we can. But I wanted to share that I'm so proud that we're changing the way people think of domestic violence. We're changing the way people are accepting that it happens and it's not the victim's fault. I know that my circumstance was about maybe 5 years ago. And even then, I did take my abuser to court. I was able to obtain a restraining order. And at the time, my abuser happened to have been an elected official as well. He was able to finish his term. There were no real consequences in terms of his job and his position. And we know now today that we're being less tolerant. We've seen people step down based on allegations. We've seen people take action. By way of example, we know a few legislators stepped down and lost their positions because of allegations of misconduct. And when there's proof and actual evidence, then we absolutely don't tolerate it. So again, I'm a little sad that we've taken so long to get there, but so hopeful that little by little we're changing minds and we're helping people understand what victims go through. So today I wanted to share a little bit about some of the legislation we've been working on. Again, I'm honored to be able to be part of a coalition of so many advocates and victims who've come together to really talk about how things happen in reality and be able to translate that into real policy that can help. And as I mentioned before, Elaine Whitefeather was instrumental in helping me early on as we passed legislation. So one of the bills that we passed early on, as a reminder, was the Phoenix Act, which was a partnership with Elaine and a few actresses, Evan Rachel Wood, Esme Bianco, and so many other advocates from the I'm Not Okay movement, which helped us extend the statute of limitation for victims. In California, we had 3 years to come forward. And based on some of the research out there, it takes an average of 7 years for someone to overcome the trauma, get help, get therapy, and be able to find that courage to speak up and tell family members, which is also one of the hardest things to do. When you have aging parents you don't want to hurt, or maybe even family members on your significant other side that you don't want to hurt. It's really something that women and men struggle with. So the Phoenix Act did extend the statute of limitation from 3 to 5 years, which is critically important, and also added a component that helps educate and train police officers to be more sensitive to victims. I remember police showing up to my home, and it's really difficult when you know your abuser is within distance. And so this includes separating the partners, the intimate partners, and asking the questions separately and making sure that there's sound barriers, because we know that a victim will not share when you're standing in front of your abuser. So that was one important piece of legislation that's now law. So we're very proud of that. I was also a teacher for 17 years, and I started paying attention, and I saw that our students as young as 5th grade, that's around 10, 11 years old, they were already manipulating each other, taking each other's phones away and pushing each other. And then outline be added to every ID card in the state of California from 7th grade higher education. So now if you have a child and you turn the ID card around from their school, from maxing out credit cards to ruin their credit, I've heard victims tell me that they go into their medical records and mess with some of the items in their records just to embarrass them. And a lot of other examples include intimidation tactics. Either they intimidate you or they say they're going to commit suicide if you don't do what they say. A lot of times they threaten to hurt the victim. Once the tactic doesn't work, they say they're going to hurt the family members. And so again, continue to keep that victim in compliance. So 1141 now has defined coercive control as domestic violence, and victims could use that as supporting evidence. And we built up a lot on the coercive control factor. This past year, I was able to co-author a bill for reproductive coercion. Again, in order to keep a victim in compliance, either they force them to have children, that is reproductive coercion, or the other extreme is women are pregnant and they drag them to abortion clinics to get an abortion. So we know that a woman should have control of their body. They should be able to say what happens to their body. No one should force them to do otherwise. So this bill 1190 will allow victims to terminate their tenancy without consequences if they're actual victims of domestic violence. So they can walk away, feel like they can do so and be free of the abuser without worrying about the financial aspect of it. And we also passed Callie's law this last year, SB 24, which I co-authored. Callie was a young lady who did the most difficult part of being a victim, and that is she walked away. She was able to walk away with her 3 children and did what we always ask victims to do: walk away, be safe. Once she was gone, the abuser started probing and trying to find out where the children's appointments were going to be. He found out that they were going to go to a doctor's appointment, and he waited outside and ambushed her and shot her in front of her children. Of course, the doctor's office didn't know that they shouldn't be releasing the information. As a teacher, I can attest to the fact that I don't think we ever knew not to share information with the abuser, whether they're going to have a school production or back to school night. And so this law will protect private information, so abusers are not seeking that information for the purpose of stalking or gunning down the victim as they did with Callie. And so I was very sad for her family. She did the hard part. She left the relationship and he actually found her and murdered her. And these boys are going to grow up without a mom. And so hopefully this law will help protect that private information so they're not gunned down like Callie was. Finally, I will share this. The last bill that we did pass was allowing victims to provide testimony in court remotely. I know there's a lot of victims out there listening who probably don't go to court or file a restraining order because they're fearful that if they go to court, again, they might be stalked, ambushed, or attacked. So this law will allow victims to not only file restraining orders remotely, but once they do and they have to go to court, they will be allowed to provide testimony remotely. They can go to a DV shelter, DV provider, and they, in the privacy and safety of an environment, could provide truthful testimony without the abuser being present, intimidating the victim. As we know, a lot of victims recant or end up not telling the full story for fear of what's going to happen because their abuser is staring at them. Or again, it's that fear that never goes away. So hopefully there's a lot of victims out there listening that really can gain the courage to go to a provider and say, help me. And everything is done remotely. They don't have to be present. The only sadness about this law that we just passed is that the courts were asking for more time to help them comply with the technology and the website and everything that they need. So they asked us to postpone it to 2023 for it to become effective. So unfortunately, it's not going to happen right away. It's going to start 2023. But the reality is once it's in place, it's going to be there forever. So that will help a lot of victims gain that courage to come forward and speak up. So I just want to thank you for indulging me and listening to all these bills that we've been passing. There's so much more to share, but these I thought were critically important to share. And so I want to thank everyone for listening. And with that, I'm going to turn it over to Elaine. Elaine, the floor is yours. Thank you.
Well, thank you so much, Senator, for that. Just life-changing as a survivor update of the way in which you used your position of influence, your story, turning pain into purpose, and really making sustainable change here in California. As a survivor, I can tell you how lifted up I feel for the hard work that you have done, that you'll continue to do. And so congratulations to you, your staff, for every one of us has a part. Just as a quick overview for how this is going to go right now, we have 4 fabulous panelists here from your area to talk about our conversation today. We're going to do it on a local and then county and then sort of statewide viewpoint of the experience so we can get a holistic look at this. Each of our panelists will have 10 minutes to kind of give you their thoughts and their perspectives based on where they're at. And they're right there on the ground and they're doing the work on the ground. And so sometimes it's sort of like an insider perspective of what's going on. At the very end of those presentations, we will have Q&A. I'm not sure how much time we will have because we really want to have that information, but understand that we will address that. The senator will close this out. If there are questions that don't get answered for you on this conversation, there is a vehicle for you to be able to put them in the chat box, and you'll use your contact information, where you're coming from and who you want the question to go to. And I am quite certain staffers are going to answer that for you and get it to the right person and get all the questions answered that you have. And remember that there is not a thing called a stupid question, and there's not a thing about how small or how large it is. Every question is significant, and every question a survivor especially has ever asked has resulted in this legislation. So let's begin the conversation. And now here it is. I'm an elder, really, really seriously an elder, who has to read this little tiny writing on this introduction. So I'm going to do my very best to do that. So I apologize to all my panels, like if I sort of miss over some things and kind of embellish you a little bit, that okay, you'll go with me, right? We've all been together for over 40 years in this field, and nothing is greater to me, nor a more nobler a position than to be an advocate and an ally in this movement. So starting off for us is Alejandra Villaseñor, who's a domestic violence case manager from the YWCA in San Gabriel Valley. One of the things about being an advocate is that you do not wear one hat, you wear many hats and in a program. So she splits her time between working in the shelter, providing housing needs. And we know that that's one of the most significant issues in a shelter, is not just getting in, but what happens after. Will there be safety after? And she also provides Spanish-speaking services to her Latinas, our Spanish-speaking community in the field. She also has a great hand in being able to address, as a case manager, the issues on racial and social justice at the YWCA. This is a very important lens, I think, and especially after COVID, that we revealed so many inequities, that we use this oppression lens. And so it's my great honor to introduce Alejandra. Alejandra, the floor is now yours.
Thank you so much, Elaine, and thanks everybody for having me here. It is an honor and a privilege to be part of this conversation and also to be representing YWCA of San Gabriel Valley. So like Elaine said, I am a case manager here. I work at the shelter as well as at our main office. So today I did want to just share a little bit about the services that we provide here in both our residential and our non-residential programs, as well as share a little bit about the new barriers that we've seen kind of emerge due to COVID, things that we have witnessed in the lives of our clients that would be important kind of to bring to the table. So to start off, I'll just share a little bit about the services that we provide at our shelter. We do have an emergency shelter and a transitional shelter all in the same place. So our emergency shelter is a 45-day program. We do take individuals or families who are actively fleeing domestic violence. So they come in through calling our shelter helpline. After calling the shelter helpline, they are introduced into our program and are kept in a safe location for the duration of those 45 days. Throughout the 45 days, they're connected to housing case management, legal advocacy, counseling services, and support groups. Luckily, we've been lucky enough to continue these services in person for our shelter clients throughout the pandemic. And then we also have our transitional program, which is designed, like the word implies, to be a transition for clients who are kind of transitioning out of the crisis or emergency and into self-sufficiency and independence. So we do work with our transitional clients to address goals of savings, employment, getting income, and hopefully securing permanent housing. And then lastly, I'll share a little bit about our main office services. We do offer 16-week domestic violence victim support groups. Our groups are court accepted for clients with open DCFS cases. And our support groups are supposed to be educational and topic oriented. So we do discuss a range of topics from what is abuse, as Senator said, abuse can look a lot of different ways. It's not only physical, and so just addressing and educating our survivors in the community about what abuse can look like. So from what is abuse to healthy relationships to domestic violence survivor guilt, parenting, kind of going over the experiences that maybe children have in homes where domestic violence takes place. So along with the support groups, we also offer case management services, connections to resources in the community. And as I mentioned before, we do have a legal advocate that services in all three of our domestic violence programs, so our emergency, transitional shelter, and our main office, as she helps with filing restraining orders or TROs for all of our clients and community survivors. So anybody who needs a restraining order for an intimate partner or a previous intimate partner, we do offer that service here through the Pomona Self-Help Center. And then, like I said earlier, we have been able to luckily continue all of our residential and non-residential services throughout the pandemic. We did not see a slowdown in calls to our helpline at any point through the pandemic. And we also did not see a decrease in people signing up for our support groups. So it's been a privilege to continue providing services to survivors in the community. As we all know, the pandemic has further shown us many inequities that were already present, and the pandemic has further marginalized a lot of already marginalized populations. And in those marginalized groups are many of our clients, whether it's being a survivor, being part of a minority group, whether it's their gender, race, sexual orientation, whatever it might be. So we have seen new barriers emerge through the pandemic. Obviously, the nature of domestic violence comes with that power and control. So most likely than not, we have seen or most likely than not, our clients come after experiencing a lot of social isolation, financial abuse, etc. So one thing that we have witnessed that is pertinent more to legislation is we've seen a lot of our clients show up to court and not have access to legal representation, whereas their partners show up with attorneys. In just the past few months, we have firsthand witnessed multiple of our clients basically have their children removed from their care and placed in the custody of their partners solely because they did not have that legal representation, and therefore their experience was not heard or taken into consideration in court. Another issue we've seen very recently, basically every client that comes into our shelter has the opportunity for us to send out what's called a good cause report, protecting them from being accused of child abduction because they are fleeing with their children to keep their children safe as well as themselves. And recently we had an incident where law enforcement actually showed up to our shelter with the abusive partner and removed the children from the care of our client because the abusive partner had basically filed and declared that she had abducted the children. So that was a enormous risk that basically an abuser was able to show up to our shelter doors and walk away with those children. And so the bottom line of expressing kind of those stories that we've witnessed recently is just to highlight the importance of that education for law enforcement and within the justice system. If we're not able to educate, or if those people in positions of power are not educated on what domestic violence is, the risks that come with domestic violence, the cycle of violence, the reasons why maybe a parent does not have income or lives in a shelter, and just kind of acknowledging all the complexities of violence. Maybe we would have law enforcement and judges and people in the justice system who would have more empathy and have more awareness of kind of what our survivors or our clients are going through. So I just wanted to bring those issues to the table, as odds were already often against our survivors due to that victim blaming or lack of education within these systems of power. But we have seen that the pandemic has added new layers to those oppressions. And then briefly, just to end, I just wanted to share a little bit about a new legislative goal that our Racial and Social Justice Committee has been exploring in our agency. So my fellow co-chair and our trauma-informed counselor, Jonathan Wicks, is taking the lead on declaring a state of emergency on childhood trauma. So I just wanted to put that out there so everybody knows about this new project. We're exploring as an agency, and hopefully you'll be hearing more about that soon. Thank you. So back to you, Elaine.
Thank you so much, Alejandra. That was fabulous and a good way for us to know everything that's happening. And I also liked hearing all about the way in which we are really weaving and returning to the issue of social justice woven through this experience. Our next panelist, Osh Ruhel. I want to personally thank you for the work you're doing as a queer elder of many colors who is just extracting herself from same-sex IPV. I thank you for the work you're doing there at the LGBT Center. She is a legal services advocate who is specifically doing very culturally specific work for the LGBTQI+ community and survivors of domestic violence, intimate partner violence, through their holistic trauma-informed approaches and advocacy and support services. She is passionate about the unified labor to lift up the voices and center the lives around the LGBTQ survivors of color who are among the most marginalized and disenfranchised members of our community and of our movement. And so without further ado, I turn that over to you, Ash, and I thank you personally again for your work.
Hi, everybody. Good afternoon. Thank you so much, Elaine, and I'm so happy to be here amongst everybody else. Like Elaine mentioned, my name is Ash. I use she and her pronouns. I am a client advocate with our legal advocacy project for survivors at the LA LGBT Center, which is situated on the unceded land of the Chumash and Tongva people. Our department is one of the few LGBTQ community-based legal services providers in the state, providing direct legal services to LGBTQ plus victims of crime. And I wanted to take a bit of time to speak to the impact the pandemic has had on our programming and our clients. As direct legal services providers and service providers, it can often feel like we're playing catch up. There are always more folks seeking support and continued challenges to that access of support. The cycle of domestic violence we have seen that is often experienced by our LGBTQ clients is exacerbated by externalized oppressions within institutions and the criminal legal system, which presents additional challenges to both safety and seeking help. LGBTQ interpersonal violence often intersects with homo, bi, transphobia, hate-motivated violence, and other types of marginalization. And LGBTQ survivors and our clients have faced heightened challenges starting at the onset of the pandemic. So just so we are aware, one CDC study found that the lifetime prevalence of IPV, or intimate partner violence, is highest at 61% for bisexual women. And according to the 2015 US Transgender Survey, there is a 54% lifetime prevalence of intimate partner violence for trans persons. We also know that our LGBTQ clients and LGBTQ persons of color are often overrepresented in categories of victimization and disproportionately impacted by systems due to the experience of historical and systemic racism. Our communities have historically experienced attempts to take away their power. Lack of awareness of intimate partner violence and harm in same gender relationships, also shame, threats of outing someone for their gender identity or sexuality in order for the partner to gain or maintain power and control, can sometimes make silence seem like the only option. As we may have heard, the tactics used by abusers that are most fear-inducing and dangerous does not have to include physical harm. LGBTQ persons can be at higher risk of violence due to lack of access to resources, stability, and support. And our clients might not seek services due to these fears, fears of discrimination and further harm by medical, social, and maybe legal services. Studies have shown that 1 in 5 survivors of same-gender sexual assault and intimate partner violence receive victim services. So in addition to these pre-existing barriers to seeking help and services, life during the pandemic provided additional challenges. So there are financial restrictors that made it difficult for some clients to focus on their legal case and maintain contact for services. Our clients also had a fear of being re-victimized through institutions that they seek support from, which made their pursuit of justice and our support of this pursuit increasingly difficult. Many did not have the stability, security, or safety to proceed with their case. Additional challenges often arose during interactions with law enforcement and or other civil and criminal legal systems, being that there is a consistent lack of culturally informed response to harm and harassment. So there are daily challenges and changes to policy, health orders, court closures, and the closure of police stations, which meant we had to constantly shift how we advocate. Folks may also not be surprised to hear that finding secure and safe emergency and transitional long-term housing resources for LGBTQ victims of violence is an ongoing barrier to providing services. Many of our clients who are trans identified may experience hate violence and victimization in the shelters they're inhabiting, and we rarely have other shelter resources to support them. As mentioned, this primarily occurs because of societal bias, homo, bi, transphobia, that then reveals itself through the harms our clients face. We know that in order to address these barriers, we must center being survivor-led, working with our clients to create safety strategies, and also centering the most marginalized. Our clients need economic justice. They need food justice. affordable, stable housing, community building, and community support to prevent isolation, which then increases risk. Education on healthy relationships, mental health support, among many things, as we know the list can go on. But given that our communities are small, it often can feel isolating. We want to continue to think and challenge ourselves to think about how we can build relationships, community, and continued support for LGBTQ communities and survivors as a means of preventing violence and harm from occurring in the first place. So I wanted to just go ahead and end on saying that in order to support where we are going, myself and my colleagues often talk about how we must be ambitious in our long-term visions for society free of intimate partner violence, of hate violence, and also other forms of harm. Being creative when we're working towards conditions in which folks can then thrive. This can be supported by prioritizing funding for LGBTQ specific programs and services, but also continued and consistent prevention funding for intimate partner violence and training for those system actors within the criminal legal system, as Ale touched on before me. That includes judges, that includes public defenders, that includes other people who are involved in the court. And I'll go ahead and end there. Thank you very much.
Thank you, Ash, for that. That was magnificent. The challenges that everyone faces in this movement are significant, and those of us who do come from communities of color or marginalized communities do face barriers, not just externally, but also internally. And so thank you very much for articulating and naming the actual barriers that we have to face before we even address intimate partner violence. Moving on our panel or continuing education and information, and even getting a greater sense of not just where we have been, but really how much what has impacted us right now. And even to hear further the impact of the pandemic on not just those of us who are the survivors we serve, but for those of us who are serving too. It was really a very big impact to all of us on both sides of this field. Our next speaker is Eve Sheedy. She is the Executive Director from the Executive Director Office on the Domestic Violence, from the Domestic Violence Office here in LA County. Eve is a Deputy City Attorney and the Domestic Violence Legislative and Policy Advisor for the Los Angeles City Attorney's Office. She has been active in domestic violence and in our issues since the mid-'80s. Thank you, Eve, for not making me be the only dinosaur here, and has worked tirelessly to pass so much legislation and laws, creating and ensuring the rights of victims. Sojourn Services of Santa Monica gave her the Sheila James Kuehl Award for commitment to battered women and their children in October 2003. She also chairs the Legislative Committee on Los Angeles Domestic Violence Task Force and the Policy Committee of the Greater Los Angeles Violence Prevention Coalition. With that, I turn the floor over to you, Eve.
Thank you so much, Elaine. I don't think we're dinosaurs. I think we're like butterflies or something like this. But I want to say thank you to the Senator Rubio, whose work has been just amazing in support of survivors and having the courage to address domestic violence in the legislature. I want to thank all of the panelists and of course Elaine, and most importantly I want to thank all of you who are attending, because it's really all of our work together that will work to end domestic violence in our communities. I just want to sort of be clear, I am the executive director of the county's Domestic Violence Council, which is housed in our department, our county level Department of Public Health. I did used to work for the city. I've been here for about 3 years. We are both the county's Domestic Violence Coalition, as well as a small office within the Public Health Department. So we're charged with raising the profile of domestic violence throughout the county and really trying to apply a public health lens to that, to sort of look at this more holistically and move us towards prevention. I am going to sort of split this up into the sort of the lockdown pandemic part, and then the right after that, and where we're headed. So, and I do want to say this, I use she, her pronouns. And I also, like Ash, I'm on Tongva and Chumash land, and I do that respectfully and in honor of those tribes and traditions. So as the lockdown and pandemic started, you know, this is a field from a provider's perspective that's really good in a crisis. So it's not a field that sort of panics, but it also, what's important, and I think what Ash was saying, as well as Alejandra, is really the center of our work is survivors. So our real issue when we started with the lockdown and me working sort of for the county government is really how did we make sure that our communication with both providers and most importantly with survivors continued as the pandemic and the lockdown went on, because we were both blessed and amazingly fortunate in LA County that our providers stayed open and changed changed the way they provided services. But many people who sought services or needed services either didn't know those services were still open or were scared to access those services because they didn't know what the procedures were with regards to COVID and so forth. So some of the work of the Domestic Violence Council was really to make sure to communicate, to make sure that all of that information continued to go out to the public, and specifically so that survivors who were addressing domestic violence would know what to do, where to go, and so forth. So we do a number of things that helped in that regard. We put out a daily email, which provides important information about what's going on. We continued to notify people about services that were available when there was food available, housing available, and so forth. We updated our website at the time, which has been very helpful. We have now over 2,000 hits a month on that. And we were able also to access the Department of Public Health's social media. And since we are the Department of Public Health, people were looking on the internet, right, to get information about COVID. And it also enabled us to be able to send information out to survivors to let them know that we were still, that our field was still providing services. As far as the council goes, we did a number of things. We were dealing on sort of a micro level, trying at the beginning, people needed diapers. We had issues where, for example, in Costco, shelters could not go and buy in bulk. So we worked with Costco, who were great, frankly, to be able to provide a procedure so that the shelters could continue to buy food in bulk to service the clients who were in shelter. We also created what we call a provider call. And then that's one of those things that in reality has become sort of a silver lining that we can carry forth. So we created this call, which included the district attorney's office, the city attorney's office, the Los Angeles Police Department, the Sheriff's Department, Department of Children and Family Services, LASA, our housing agency, the mayor's office, a shelter-based agency, a non-shelter-based agency, an agency representing the LGBTQI community, and civil legal providers who focus on DV, and the Department of Mental Health. And we spoke to start 3 times a week to keep up with and keep each other informed of what was going on. And that kind of contact has enabled us to sort of stay together and to make sure that we weren't having these major gaps of where people were being lost. And those calls are now down to once a month, but they continue to go on. And those connections that are made really help to tighten the safety net that our survivors need in LA County. We also put on a number of webinars, which I won't list, but we did a webinar about sort of mental health during COVID. How do you make yourself feel better? We had over 700 people attend. We did continuous updates on the legal system. And importantly, I think as everyone has mentioned, additionally, we have really tried to address our services to the BIPOC community. And one of the things we did was create these ongoing conversations of how the domestic violence field can better support the Black community in Los Angeles. And we have put on with 2 agencies in South LA who are amazing agencies run by Black women. We have put on 4 conversations. Our 5th is on November 10th in order to really continue our work throughout the county to make sure that we are responsive to the needs of everyone. So where are we now? I will say from the public health, I am from public health, the pandemic is ongoing. We all have to be careful. And we have really worked to strengthen the tools that we developed maybe during the pandemic, during the lockdown, to continue to make them be effective. So we continue our daily email. The address, I think, is being provided if you'd like to sign up for that. It's a digest, so you can delete it if you don't feel like reading it that day, but it's really very helpful. We archive all of those on our website. We continue to work to make sure that our work is survivor-centered. We have tried to center those issues that are most important to survivors. For example, there are, and I believe someone mentioned this, there are a number of issues that survivors address in family law court. So we are addressing those. We are trying to focus on issues with domestic violence survivors and veterans, another issue that is not always addressed. We have also worked with other departments in the county, including the Department of Children, not Children and Family Services, the Consumer and Business Affairs. We work with them, and they have now been granted $1.4 million to distribute as flexible funding for survivors of domestic violence, which is really one of many times the concept of flexible funding is critical in terms of supporting survivors, but many times that funding is attached directly to housing. And in this particular setting, this is coming out of the Department of Consumer and Business Affairs, who offer financial empowerment services, but now will be distributing funding directly to survivors to address their individual needs. We have a DV reopening task force, and importantly, we continue to work with Senator Rubio on issues related to domestic violence and child welfare. And I want to personally and for the entire field thank her. These are issues that have gone on for decades, and we are so thankful to the senator for recognizing how important it is for the people that we serve to address those issues, and takes a tremendous amount of courage, and we're incredibly thankful. So where we're headed, we continue to work to increase survivor participation in our council and work to lift their voices. We continue to do the DV child welfare work. We continue to work to really support our BIPOC communities and to make sure we reach out across Los Angeles County. We continue to look at new housing models. We have emergency and transitional housing. We have learned through various programs, DV Housing First, other programs, that survivors can thrive through other housing models, that not everybody needs emergency housing, but we need to develop and support other housing models. We continue to try to look at this through a public health lens, holistically, and not only through addressing social determinants of health, but also including how do we improve our services for people who may be abusive, because we cannot address domestic violence without dealing with the entire issue. So we have obligation to make sure those services actually work so that we can prevent domestic violence in the future. And we continue. I want to stress what everybody has mentioned. This field sort of began with pictures of women who were beaten up, right? So we all had, well, you may be younger than I am, but there were many posters of women who were physically injured. And that was sort of how this was brought forward. The reality is, although there is way too much physical injury, it is a pattern of coercive control. There are many kinds of abuse which are equally as painful, as harmful to both the survivor and to the generations of people who come after that survivor. So thanks to the senator, we are starting to look at that also more holistically and understanding really how coercive control is really what domestic violence is, and physical violence is part of that again. And I just want to say there are related issues that are so important. For example, we have in California the Brown Act, which governs public meetings. Because of the pandemic, we developed a model where we could have meetings remotely. So we are now looking to these hybrid models. People who cannot get in a car and drive across Los Angeles for an hour to go to an hour meeting need to be part of that conversation. So we need to continue to look at these connected issues to make sure that everybody can participate in this conversation. And we hope that those kind of things live on. And finally, I think other people have touched on this. We have a tendency to silo our social services. We provide substance abuse help or mental health help or housing help or whatever it may be. And what we know, everybody on this call, is that's not how people experience issues. They experience them, all of us who work in these fields, we're all dealing with people who are having to go from place to place to place. So we really continue to work, whether it be DV and child welfare, as I said, so supported by the senator, whether it be DV and substance abuse, DV, and I've done a lot of work about domestic violence and gang violence. All of these issues are connected. And hopefully as we move forward, we will continue to design our service delivery in a way that is most meaningful to the people who we are serving. So we are on that path very much with the help of legislators like Senator Rubio, and I hope we will, and really by the work of the people you've already heard, and you'll hear from Krista, but it's really that kind of opening our eyes and connecting to each other and really looking to how we can prevent this that will stop domestic violence. So thank you very much. Thanks very much.
Thank you, Eve. That was phenomenal. Thank you. Thank you so much for that, and very clearly, concisely articulating for us, not just where we've been, but I think also forward. You've really laid out a table there for the senator, and already to add to her buffet of the things that she's doing to make sure that there is sustainable change. Our next panelist, it will give us an overview from the state. And for those of you who don't know, the partnership is one of the most significant organizations to member organizations who do provide services to the domestic violence field in California. As an old-time veteran who was part of the coalition at the very, very, very beginning of time in California, it seems like, it is so encouraging and important that folks in the field have an ally and an advocate for them. And as someone who has run many organizations, to have a liaison between the partnership and the funders and our legislators is a significant, significant piece of the wheel that keeps everything moving, so that those of us down on the line really truly have what we need and have a voice that is credible. Krista, nice to see you again, Krista. Krista is the Public Policy Director for the partnership, and she represents the domestic violence programs throughout California. I see her at many, many different government gatherings and public gatherings throughout our state, including the California State Legislature. Through the advocacy, Krista ensures that the voices of domestic violence programs and providers and survivors are heard and reflected. Our voices and our perspective and our experiences are reflected in any policy that's going forward. We cannot in the field thank the partnership enough for everything that they do. And so it's my pleasure to introduce to you, Krista, you're up next.
Thank you, Elaine, for that very kind introduction. So as Elaine said, my name is Krista Colon. I use she, her pronouns. I am joining today from Ohlone Land in the Bay Area, and I have the tremendous privilege of working for the California Partnership to End Domestic Violence. As Elaine alluded to, we as an organization do not provide direct services to survivors. Rather, our work is to help support and uplift the field of amazing advocates and programs like the folks that you've gotten to hear from today. I have the tremendous honor of working closely with these advocates day in and day out and hearing about the incredible work that they do in communities all across the state. As an organization, we are deeply committed to prevention of domestic violence. We believe strongly that this type of violence and abuse is not inevitable in our communities, and that we can make changes to both support survivors and their families when harm has occurred, but also change these conditions to prevent violence from ever occurring. And so when we think about where we're going, that is the big long-term vision that our work is in service of. But for today, I want to talk a bit about what we have been doing and what we're thinking about as we look to the year ahead. I also really want to thank you, Senator, for pulling this event together and bringing us all here. This is such an inspiring and powerful way to wrap up Domestic Violence Awareness Month at the end of an incredibly hard year. As you have heard from all of the panelists so far, COVID has continued to take an incredible toll in our communities. As Eve said, this is a field that is good in crisis, and we are. And every day during this pandemic, advocates have proven this, from reimagining how you provide shelter in a communal space during a global pandemic, how you help survivors navigate a court system that no longer is convening in person, how you continue to meet a need 24/7 while your entire staff and the community you serve are facing the same challenges and struggles. And this field has done amazing work. This has been a long, challenging pandemic. And so for every advocate and service provider out there that's listening today, I want you to know that you are seen and the hard work you have done is seen. We know you're tired, and we appreciate every bit of work that you are doing. The pandemic has also, of course, created tremendous challenges for survivors. And we have heard throughout the pandemic about the increased rates of physical violence, the severity of violence, higher risk of lethality when survivors are finally reaching out for help, tremendously complex needs and challenges. And of course, all of this intersects with all of the other barriers that already exist for marginalized communities. Right? Survivors who already face challenges in navigating our systems due to homophobia, transphobia, and racism. Survivors for whom English is not their primary language, navigating a system that operates largely and frequently in English-only spaces. And so we've seen that those challenges have simply been magnified during the pandemic. That said, there have been bright spots. 2021's legislative session and budget season in many ways brought surprising good news. And I really want to thank the Senator for the work that she has done in authoring and co-authoring many important bills this year. On our Twitter page, because everything exists on social media in one way or another, we did post a wrap-up of bills that were signed, some that were vetoed at the end of session that we were supporting. So you can see that there, and I think we'll put that link in the chat as well. There were some real important highlights that we hope have continued to move forward on issues like access to our courts. As many of the panelists have spoken about, our court system can be a place where survivors find real safety and protections that they need, and also a space of real challenge and barriers, and that there continues to be work that's needed to be done. So we've seen some important wins there. We've continued to see the development and support of alternative responses to domestic violence for survivors who choose not to engage with law enforcement and the criminal justice system, but still deserve and have the right to access safety. And legislation that has touched on every corner of survivors' needs. In the budget this year, we were delighted to see the state step up when federal funding had been declining for several years and programs were at risk of seeing budget cuts coming at a time when funds simply needed to be increasing instead of reducing. The state provided $100 million in backfill for the Victims of Crime Act Fund, which funds domestic violence programs across a whole range of services, as well as other crime victim services. The state also continued to invest in prevention, providing another $15 million for sexual and domestic violence prevention, which will fund programs for another 2 years through a competitive grant application, which should be released soon. We are committed, however, to getting those dollars included on an ongoing basis. We were delighted to see the legislature provide those funds again for the 2-year period, but we know that the work to do prevention requires ongoing sustained funding. So we will be back in those conversations soon with the legislature and the administration to make sure we can secure them in a more ongoing way. I'll also name here for folks who want to dive deep into legislation and understanding the new laws that were passed. Every year we host an annual new laws webinar that covers the impacts of every new law related to domestic violence and what advocates need to know. This year, we'll be hosting it in January, and so registration hasn't opened quite yet. But if you follow our social media and sign up for our newsletter, you'll be sure to see the announcement when registration does open. So as we think about where we've been and all the challenges that you've heard laid out from the programs here today, we are planning ahead for 2022. New Year is right around the corner, and we know there's immense work still to be done. So a few issues that we already know we'll be working on. Funding. I think as you've heard from everyone here, the need from survivors is immense, and the resources that programs have to meet that need is never enough. So funding is consistently a big part of what we do. This is actually a big part of our federal policy work, which I want to name here. We don't always talk about federal policy when we're in these state level spaces, but the vast majority of funding for domestic violence services comes from the federal government. So we work quite a bit in this space. We are anxiously awaiting a final federal budget. They're operating right now on a short-term bill, which is not uncommon at the federal level. But we're excited to see the possibility of new investments in these programs. One thing we are specifically advocating for and working for is new funding for culturally specific services and for traditionally marginalized services and marginalized communities. So as Ash spoke about, there's very little funding dedicated to LGBT services, dedicated to communities of color programs, programs by and for traditionally marginalized communities. And that needs to change. There's opportunity to do that at the federal level, and we'll keep working for that. And as I said, we're committed to funding prevention. So that work will continue. We'll share out with folks who are following our social media lots of ways to be involved in that effort year round. So please look out for that. You've also heard from everyone here today about housing. And it's hard to think of any issue in the state of California that housing doesn't touch, but for domestic violence, this intersection is fundamental. Domestic violence is one of the leading causes of women's homelessness, and the housing and homelessness services that programs provide have been some of the most impacted during COVID, right? Hard to think about how you provide communal shelter spaces when it's not safe for folks to necessarily be in such close contact with one another during a pandemic. Programs have pivoted for the entire duration of COVID now to be able to provide hotel and motel stays, social distancing, think about everything they can do to help keep folks safe while still providing for their emergency housing needs. We are committed to helping make sure survivors can stay housed and stay in their current homes if that's safe for them, helping them prevent eviction. but also improving the state's homelessness system to make sure that it better responds to the needs of survivors and really recognizes the needs of survivors and the needs of women experiencing homelessness throughout everything that we do to tackle homelessness as an issue here in the state. Of course, closely tied into this is economic justice issues. It's a deep intersection with housing when we think about credit scores, the debts, which can be a huge part of domestic violence. The economic abuse that many survivors experience leaves them especially vulnerable to the inability to find new housing if their credit's been destroyed, if their ability to stay successfully employed has been interrupted because of the abuse, their abusive partner has incurred a number of deaths in the survivor's name. All of those can be real struggles. And so we're working on all of those issues. We're incredibly excited about the flexible funding pilot that Eve mentioned is happening in Los Angeles. We're excited and crossing our fingers for some funding to do something similar from the federal government and really thinking about what that can look like statewide here in California. Within this economic space, we also recognize the importance of things like paid leave, which has been a big topic, of course, these days of discussion at the national level. But even here in California, where we do have a paid leave program, there's more that can be done to strengthen it, including increasing wage replacement rates, increasing length of time, adding more paid sick days so that every worker in California can take time off. And for us, these economic supports are not just about how we support survivors, but also about how we prevent abuse in the first place. We know that if we can help reduce economic stress and strain in families, we can reduce the likelihood of violence ever occurring. And so these are also very important preventative measures at a big picture societal level. Finally, a few more issues we are working on is, of course, the child welfare system, and we're very grateful to the senator for stepping into this space with us. It's a complex intersection that we know will require tremendous engagement and work, and we're looking forward to making real positive change for survivors who have to navigate through that system. And then the court system generally continues to be a topic every year, right? There's been great work done, and Senator, we're excited about the bill you worked on allowing remote access and remote testimony, but we know there's more, right? So we know there will be court-related bills as well. And then immigration and how we support immigrant survivors remains a key component of our work here at the state level and a key component of what we do at the federal level. So as you can tell from that list I walked through, we focus on quite a few issue areas because we know that survivors' lives are not a single issue. The ways we support survivors require that we engage with a broad range of systems and structures. Doesn't fit neatly into one box or one legislative committee. And so we are committed to being present in each of those areas to whatever extent we can. And so with that, I really just want to express appreciation to all of my fellow panelists today, Elaine for moderating us, and Senator for all of your work, including this event today. Thank you.
Thank you so much, Krista. We are such an efficient group right now that we got to get done a little bit early. I'm gonna, I want to turn it over to each of you one more time, right? So this is your spontaneous moment, but you're all used to that. First, thank you very much. And I think the thing that I take away from everything is the way that you were able to articulate, each of you independently and collectively, the complexities of this issue and how they must be addressed on multiple fronts, from the line work all the way to the national, on the national level, and how we really must collaborate and learn to intersect with one another. Also, you articulated very carefully, especially through Senator's work, all of the tiny little pieces that may not seem important by themselves, but they're all interwoven and interlocking, and they create indeed a very secure safety plan. I thank you as a survivor, as a mother, as a sister survivor in this field. I just want to run through with everybody in the same order that you spoke. This is Domestic Violence Awareness Month. And so my ad lib question to you all is to not to just the survivors. I'm going to leave that for the senator to speak to, but I would like for you to give maybe a thought or a word of encouragement or a piece of wisdom that you could share to the general public about how they can be helpful in this time, if they should know someone. Is there something that each of you would like to speak to about this issue that you didn't get a chance to? Let's go run it through right from the very top, and I'll start with you, Ali, first. Alejandra.
Perfect. Thank you so much. And thank you everybody for those incredible presentations. It's an honor to be here and to get to learn from each of you. I think what came to mind for everybody listening is just, you know, we all have it within ourselves to be an empathetic listening person. So if we ever do come across anybody who is experiencing violence, or, you know, who is in a relationship where you're noticing these red flags that maybe we mentioned throughout the presentation, just to be a person who's listening and validating and providing, you know, that encouragement or empowerment for that person. Just it takes one person who believes you for you to be able to feel maybe empowered enough to leave. And so if you can be that person for somebody, to even just look them in the eye and tell them, I believe you, that can be, you know, that pivotal moment for that person. So that's what I have to say. Thank you for having me again.
Oh, thank you so much for that. But being believed is really a very big foundational beginning for most of us and all of us. Ash, up to you.
Hi again. So I will mention that I believe it was shared within the chat, but I just wanted folks to be aware of the services we do have within our department that are for all survivors and also folks that are seeking immigration support. We have a trans economic empowerment program and a general legal clinic to support legal needs of anybody in the community that also identifies as LGBTQ or not. And I think a note I will share is that I believe we all have the capacity or space to hold space for survivors, and also can be intentional about our efforts to actively combat homo, bi, transphobia and racism specifically as it impacts institutions and it impacts our BIPOC LGBTQ clients and persons. So I think that's just one note I want to share. I think we all have that within us to have that empathy and have the power to speak up against any time there's an injustice or an active form of homo, bi, transphobia against survivors of harm.
Thank you so much for that. I appreciate you very much. Eve, I am coming to you for any additional remarks you'd like to add.
Okay, I think you asked for one thing, and I always say lawyers never listen to instructions, so I'm going to say two things. One is sort of, I believe what the last two women have said, which is don't judge, please don't judge. Everybody, you don't know how you would be in that situation. Everybody's truth is their own, and be supportive. And secondly, on a broader level, we have to have language to talk about violence. It cannot be embarrassing, shaming to talk about violence. Violence is in all of our communities. It is in people's homes. And until we can openly have these conversations and hold up people who, whether or not they are being victimized or they are acting violently, until we can openly talk about this, we can't resolve it and we can't prevent it. So please, 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 I know it's uncomfortable for some people, but the more we can develop a language to talk to each other, the better work we can do.
Perfect. Thank you so much for that. Krista, I'm coming right back to you. I would like for you to go just a little bit further, because you do have interactions and do a lot of work for all of us at a national level. From a national level, What is our inspiration? What can we look forward to? What are the words you can encourage us to keep fighting and doing this? Yes, we're pretty weary right now, all of us, but we're coming toward the end of the year. And I know as a survivor, the thing that's most important to me is to never give up hope. So from your national lens and all that you, I mean, California's inspiring to me. Look what y'all are doing. Look what the senator's done. It's inspiring. But are we also getting that match at the national level? Can you speak to that?
Absolutely. So California is always a leader, and California leads the way on so many issues. But we are excited for lots of things happening at the federal level. The White House has a gender policy council that is currently working on a first ever national action plan to address gender-based violence. They've been doing a listening session virtual tour, hearing from stakeholders working on every aspect of addressing gender-based violence, including those working with people who have committed violence and harm to change and to develop new strategies to address conflict in their relationship in healthy ways. And I'm really excited to see what comes of that. We have tremendous leadership at the national level that is dedicated and committed to this issue. I think many folks listening may know that President Biden, when he was a senator, wrote and passed the first ever Violence Against Women Act in 1994, which was landmark legislation. And, just as I am inspired every day by the advocates I get to work with here at the state level, there's an amazing team of folks working hard on these issues at the national level. And Elaine, just because, like lawyers, policy advocates never listen to instructions and never do just one thing, I want to take just a quick minute to add a bit to your first question about what the general public can do. And in addition to everything everyone else said, I want to also name that in addition to seeing if you know someone who's experiencing violence, bring that same openness, willingness to talk, willingness to listen to someone who you think might be using violence in their relationship and committing harm, and who may be struggling with how to change and how to better, approach their relationships. Also, we'll name that any one of these organizations, if you call their crisis hotline, they are a resource for friends, family members, colleagues who may want to know how to help and support someone they care about, in addition to if you yourself are experiencing that violence. And so is the National Domestic Violence Hotline. So just as we wrap up, to leave folks with a resource and a number, if you do need someone to talk to, the National Domestic Violence Hotline is available 24/7, 365 at 1-800-799-SAFE. Thanks, Elaine.
You're welcome. Thank you all very much for your final comments. I have just a second and I'll do mine and then hand that over to the senator to close for us. We've been through a very difficult time, you bet. And this pandemic has really, I think, revealed the strength of our field and the covenant we have with every survivor we serve. On the other side of this, my last words to all of us, especially in the field, advocates, all allies, every one of us who does this hard work. So my words are to you. On this side of the pandemic, a beloved community of humanity is really what I'm hoping we will all strive for. And whether we do that through a legislative policy way, we do that from innovative programs, using our voices in louder, more bold and bodacious ways to speak on behalf of the suffering of others. And so that beloved community is something we long for, we need, and will get us through to the next place. I think the senator and everything that she does and the way that she has woven that all of us together to do these pieces represents the seeds of that beloved community. Every advocate and every ally for all my 40 plus years has been part of that. And so I'm asking us all in the general public two things. If you got a question, please forward the question to the senator's office. She'll get it out to whoever needs to answer those questions. And no question needs to be left unanswered, because that might be just the thing you can do. The second thing is, let us continue to understand that our silence contributes to the issue. So let us also break the silence that makes the doorway easier for someone else to walk through, and take their hand and understand we are stronger than the things that happen to us survivors out here who are listening. We are much more than that. But we, and as survivors here on this panel, we are showing you with our allies and our advocates what sustainable change we can make. And so, being the queen of sustainable change right now this month, someone I admire and will always speak highly of, I'm going to turn it over to you, Senator Rubio, for your closing remarks. And if you'll also, in your closing remarks, if you'll also provide any tips you would like to give to survivors and for their safety and well-being. And I thank you, as always, for the honor, every member on the panel, and the honor, Senator, of having worked with you. I turn the remaining of this same time to you.
Thank you so much. I'm just incredibly honored to be here with all of you. You know, I used to be an educator for 17 years, and we've heard this over the years. It takes a village to raise a child. However, I almost feel in the same sort of vein in this arena as we speak about domestic violence. It takes a village to make change. And I don't want to wrap up without really highlighting how much we rely on each other. When I talk about policy that I pass in the legislature, I don't pass the policy on my own. Krista can share all the times that my office and her are in communication. I've asked Elaine to provide testimony. I've worked with Mike Fewer, the LA District Attorney, and I keep reaching out to people that can be helpful, because it doesn't happen alone. So I want to thank all the partners throughout my tenure as a senator who have been part of getting these policies passed. Also want to make sure that I highlight some of my colleagues who've been instrumental in helping pass legislation. Most recently, I've partnered with Senator Dave Min. I've partnered with Ana Caballero, who was the lead on Cali's law. I partner with so many other legislators. So I want us to know that this is a collective effort. It's not one person doing it alone. It does take someone to take the lead, but all of us working together. So everyone here on this panel and all the other organizations that I've reached out to that have also been instrumental in helping me, I want to thank you on behalf of victims as well. I wanted to also provide my advice. I know that we're talking about advice for the general public, but I want to turn it over to advice to some victims out there that may not have, the ability to speak up right now. And I want to give this following advice only because I know we've been isolated. The pandemic had really created barriers, even, bigger barriers for victims. As we were asking people to shelter in place, that was the safest thing to do. And we called it safer at home. And the irony here is that that is not the case for victims of domestic violence. Staying at home longer hours with someone that already has a tendency to be abusive, in a time where people were losing their jobs, in a time where people were stressed over just the pandemic in general, those stressors created a little bit more of a frustration for someone that, again, has those tendencies. So I want to just turn it over to some of the advice that I want to impart with those victims out there. It worked in isolation when they were sheltered at home, but it also works as we come out of the pandemic. Number one, I think that we tend to reach out to one another when there's a need. But when you know that there's someone that's struggling with domestic violence, to those victims, if you are struggling with domestic violence, please always have a trusted friend or family member check on you daily. That phone call every single day is critical, whether you're sheltering in place in isolation or coming out of isolation. They must check on you daily. Number two, for those that have struggled with domestic violence or are still in those type of relationships, I want you to scan the room. I want you to make sure that anything that can be used as a weapon is put away. If there's knives on the counter, I encourage people to put them in the drawers. If your child goes to baseball, little league, and there's a bat laying around, that can become a weapon in the heat of the moment. And that may mean the difference between life or death. So let's put all the sharp objects, all the potential weapons away from sight and easy access, because that's the first thing someone's going to grab, an abuser is going to grab if there's a moment of abuse. Third, always have a plan, a safety plan in place, which will include knowing where the closest police station is, which will include memorizing the domestic violence hotline number. When you're in trauma and you are stressed, it is difficult to either look at that ID card that I shared earlier in the back to find the number, or go through your phone to try and find the number. Memorize it. Be ready to dial that number for help. If you are in immediate danger, then dial 911 for the safety of your family. But please also talk to a friend or trusted family member and develop a secret signal. I know a lot of times victims can't speak freely when they're talking to their family members on the phone or their friends because the abuser is standing right there. So develop a secret word. It could be as simple as saying the word dancing or cooking or dyeing my hair. That should signal to a friend or family member, you are in danger and they should be calling 911 for you, because you cannot dial it for yourself. And I would leave you with those tips to remember in case you're currently in a situation and you don't know how to get out of it. I also want to share for parents. Again, as a teacher, I remember a lot of things, and I remember parents often saying, no, I ask my daughter all the time if her boyfriend hits her. Earlier, I started with shifting the way we think about domestic violence. So my advice to parents out there is, yes, ask if they're being physically abused, but the question now should become, is your partner, intimate partner, coercing you? Is he taking your phone away? Is he preventing you from having friends? Does he not like it when you hang out with your family? When I go talk to high schools and I ask the question openly to 200 kids, and I'll say, does your boyfriend take your phone away? And I am amazed at how many students raise their hands. It's something so natural, but that is already coercive control that may lead to something more serious, which is physical assault. So please, parents, ask, are you being physically assaulted? But also, are you being coerced by your intimate partner? Thank you for allowing all of us here to speak with all of you. And I've learned a lot too. I've learned what we need to do in the coming years. I heard a lot of need, a lot of unresolved issues that we still need to tackle as a legislature. I've heard a lot of suggestions as to what I should be working on in terms of next steps and next legislation that I should be championing the following year. So I'm going to take all that we've learned today, reach out to some of the partners on this call right here and see how we can, make what we just discussed here, put it into a plan, into action, and hopefully legislation next year. And to all of you out there listening, thank you for allowing all of us here to speak to you. As we close out Domestic Violence Awareness Month, it is important that we continue to educate, engage, and continue to put this conversation in the forefront. 50 years ago, it's not a conversation people wanted to have. I am encouraged that we're here having this discussion in the open. I'm encouraged that I'm able to share publicly that I'm a survivor, as well as some of you on this panel. And I want us to continue to tell everyone that it's okay. That feeling shame is normal, but we didn't do anything wrong. It is not our fault. And we need to support. I will also just say to all the victims out there, we hear you still. We see you still, and we will not give up on you. We will continue to pass legislation that will support you, put programs in place that will help you. And I heard there was a question on the chat that asked about undocumented individuals. I want to encourage those without proper documentation to please speak up. There is protections for you. There are visas that you can get as a victim of domestic violence. And there's all these service providers that are ready to help you through the process. Just because you are not properly documented does not mean you need to stay silent. Your life depends on it. Your children's life may depend on it. And we're all here to help. So to my wonderful, wonderful panelists, and to my moderator. I cannot thank you enough. And I hope that we can convene another one of these in the near future so we can continue to update our public, our victims, and continue to share ideas, because ideas is what grows legislation. So thank you so very much. And I hope you stay safe. And I hope that you continue to check on those friends that may be in trouble. So once again, thank you. It's been an honor, and I wish you a very good day and stay safe from the pandemic. Have a good day. Thank you, everyone.